Welcome to Oral Health for Women, including pregnancy and across their lifespan. This is a course that was put together by Smiles for Life, which is part of a national oral health curriculum. The course addresses the importance of oral health before, during, and after pregnancy, and clinicians, including you guys, will explore the prevalence of oral disease during pregnancy and its consequences for both mother and children, as well as review some dental treatment guidelines for pregnant women. So what are our objectives today? Today we're going to look at describing basic oral anatomy, going over terminology, and oral screening. We'll develop a familiarity with the etiology and risk factors of periodontal disease and dental caries, also known as cavities. We're going to understand the evidence for periodontitis and how it affects pregnancy outcomes. We're going to look at and understand the evidence for caries, risk transmission from mother to child. We'll look at managing common oral conditions in pregnancy. We'll seek to understand the safety of common dental interventions in pregnancy. We'll look at collaborating with members of the interprofessional team to manage oral health in pregnancy. And then finally, understand and promote oral health issues across the lifespan. The big key for this lesson is to really look at basic oral anatomy, terminology, and oral screening, and then get a familiarity with the etiology and risk factors for periodontal disease and cavities. To start out with, getting familiar with the common dental language and dental nomenclature really helps facilitate effective communication with dentists, and these guys are our primary collaborators in this area. Starting with the anatomy of the tooth. The outer protective layer is called the enamel, and it's extremely hard. The middle layer is called dentin. The pulp is composed of nerves and blood vessels that exit the tooth via the apices, and then the root connects to the alveolar bone via the periodontal ligament. Permanent teeth begin to erupt around age 6, and all are in by 21 years. Some adults have their third molars, which are also known as wisdom teeth, or premolars, often are extracted to relieve crowding. However, sometimes they don't ever erupt, so there may be only 24 to 28 teeth in an intact appearing detention. And that is also known as their full set of teeth. Most adults have 32 teeth, and this includes 8 incisors, 4 canines, 8 premolars, and 12 molars. Gingivitis. And you can see here some erythema and swelling of the gingiva, which are classic of gingivitis. Gingivitis is an inflammation of the gingiva without destruction of the periodontal ligament or bone. And this is what distinguishes it from periodontitis. Pregnancy-related gingivitis affects about 25 to 75% of pregnant women. It likely occurs because of immunosuppression and hormonal changes, which cause an altered response to bacterial plaque. So what are some of the symptoms? This includes mild gum swelling, tenderness, erythema, bleeding gums when they're brushed, and it is typically identified in the 2nd month of pregnancy and peaks in the 8th month. So what are the causes? Usually it is triggered by plaque buildup from poor oral hygiene, and that is what triggers the inflammation. Changes in hormone levels also occur as a result of puberty, pregnancy, and diabetes. And these modify the gingival response to plaque, resulting in increased gingivitis. During the 2nd trimester, there is a shift from the predominant periodontal pathogens to destructive anaerobes, and this frequently triggers gingival inflammation. Finally, there is a decrease in cellular immunity during pregnancy, and that exacerbates this process. So what can we do to help prevent and treat? First off, maintain excellent oral hygiene through frequent brushing and flossing, and also encourage pregnant women to get regular dental visits to monitor oral hygiene and reinforce appropriate home care. Periodontitis. It's a chronic inflammatory disease of the periodontium, which occurs in response to bacterial plaque on teeth. Progression of the disease results in destruction of the supporting bone, increasing tooth mobility, and eventually resulting in tooth loss. It is a common oral disease affecting both pregnant women and other adults that can impact up to 15% of pregnant women. Symptoms. In the earliest stages, they may have no obvious symptoms. Dentists, however, can detect early disease through clinical probing of the gingival and through radiographs and evaluation of the gums and bones and teeth. Patients with advanced disease will have loose teeth. So how does this work? What's the etiology? Chronic exposure of the periodontal tissues to bacterial plaque causes a chronic inflammation. The body's host response to the bacteria, through either magnifying or suppressing the inflammatory response, helps to determine the manifestation and progression of the disease. Chronic inflammation leads to destruction of the periodontal ligament, loss of supporting bone, tooth loosening, and eventually tooth loss. Smoking, diabetes, HIV, pregnancy, poor oral hygiene can all contribute to the development of periodontitis. So what do? Good oral hygiene and regular dental visits to help monitor hygiene and remove any plaque below the gingival area, help prevent or controls inflammation. Established disease may require more advanced dental treatment, including deep root scaling, which involves cleaning below the gum surface, and antibiotics. So, what causes dental caries? Dental caries develop when oral bacteria interact with dietary carbohydrates. The bacteria metabolize the sugars from the carbohydrates into acid, and this dissolves tooth enamel, especially in areas of existing enamel weakness. If the oral bacterial load is reduced or carbohydrates are ingested less frequently, less damage to the enamel will occur. So how do we treat this? Prevention is the key. Good oral hygiene, which includes twice-a-day brushing and daily flossing, proper diet, which includes no sugar between meals, dental visits twice a year for cleanings, examinations, and x-rays as needed. If cavities exist, restorations such as fillings, extractions, or root canals may be needed depending upon the degree of the disease. And again, root canal is the cleaning out of the center of the tooth to preserve its integrity and save the tooth. What are some risk factors for oral disease? First one, behavioral. Poor oral hygiene habits, alcohol and tobacco use, eating a diet high in sugar, and lack of routine dental visits. Individually, this could be a history of caries or periodontal disease, having another chronic disease such as diabetes, having low social economic status, taking medications that contain sugar or cause xerostomia, and emotional or physical disabilities which prevent them from being able to maintain kind of the behavioral risk factors. Environmental, they could not have access to fluoridated community water and poor access to dental or medical care. So what do we do to check the oral cavity? A systematic approach to examination is important. An OB provider should, at the minimum, examine the teeth and gums for hygiene, inflammation, and disease. And I will put up online a complete exam module that you can review at your convenience if you want to review the specific procedures. To do an exam, you have to have good lighting, a tongue depressor and a pair of gloves because you're going to be reaching into the mouth. You want to use a systematic approach. And again, the same structure over and over again. Look at the internal structures, which include the teeth and gingiva, the soft and hard tissues, the lateral borders and undersurface of the tongue, and take a peek at the posterior pharynx. At the external structures, you'll be looking at the lips and palpating the floor of the mouth and the neck. Moving on to the effects of periodontal disease on pregnancy. In this chapter, we're going to really looking at understanding the evidence for periodontitis having an impact on pregnancy outcomes. Numerous studies have documented an association between maternal periodontal disease and preterm birth and low birth weight. There are several potential explanations for this association. Periodontal disease may have direct effects on the uterus through bacteremia, causing direct inflammation of the chorioamnion. However, it is more likely that an indirect mechanism is mediated by a systemic inflammatory response. Looking at basically the direct mechanism, periodontal infection in the mouth may have direct effects on the uterus through bacteremia, causing direct inflammation on the chorioamnion. However, bacteria have not been found in amniotic fluid cultures. Information on the indirect mechanism. It is more likely that preterm birth results from a systemic inflammatory response to periodontal infection that increases prostaglandins and interleukins and affect labor initiation. The inflammatory response may lead to placental blood flow restriction, placental necrosis, and consequently low birth weight. A similar mechanism has been proposed to explain the association seen between periodontitis and the increased rates of heart disease and diabetes.